Hi, I'm Gail Olson. I'm the chair for the Texas District 11 section of the American College of Obstetricians and Gynecologists.
And hi, I'm Sarah Wakefield, the medical director for the Perinatal Psychiatry Access Network in Texas. We're here today to talk to you about ways PeriPAN can support the mental health care of your pregnant and postpartum patients, including our PeriPAN OB Toolkit. So today in our toolkit discussion, we'll be reviewing some screening tools, which ones to use and how to score them, clinical resources for you and patient-facing resources, and how PeriPAN can support you in real time in your day-to-day practice. If you would like to follow along with the toolkit, please look at this QR code and follow along as we go through the toolkit today. So a little bit about PeriPAN. PeriPAN is your partner. We create tools that OBs and other perinatal clinicians need to expand their capacity. One tool is the PeriPAN Mental Health Toolkit. You can find the toolkit on our website at that QR code you just hit or at texastxperipan.org. Today, we are going to walk you through the toolkit, go through those screenings, how to score, when to call us, and we will talk about psychoeducation and other clinical guidance and tools we've provided you in the toolkit. So let's get started. Here's the overview or the title page of our toolkit. We've worked with Dr. Olson and other clinicians to create a usable and practical resource for you to help you expand capacity and know when to call PeriPAN for mental health guidance for your perinatal patients. We've pulled resources together so that you have one place to go. The toolkit builds on and improves a previous version used in Massachusetts and now with ACOG guidelines. We have pulled multiple resources in one place for your reference and use. Usable piece of information clinically within your practice. So there are lots of things in this toolkit. It covers lots of different areas, and we want to make it as usable as possible for you. We have some overview and basics of mental health care of pregnant and postpartum patients. Also an outline of different perinatal mental health conditions. But what we really want to show you in this toolkit today is our screening packets that you would be able to print off and hand to a patient with the recommended guidelines for different screeners to use. We have two packets, packet 1 and packet 2. They are identical except for the difference of using the Edinburgh postpartum depression screening and the patient health questionnaire, the PHQ-9. We have these two versions because many of our systems have been using the EPDS for a prepartum, a perinatal screener, and a postpartum screener. Sometimes because this screen was validated in Scotland, it doesn't translate as well for women using American English and can get a little confusing. And so we also recommend using the packet 2 with the PHQ-9 version. But if your system has the EPDS as a part of their protocol, we did provide the packet 1 for you as well. What's really exciting is when you go to this website, you can see many different tabs here, and you're able to print off and look at the entire toolkit at one time. But if there are different pieces, as you familiarize yourself with this toolkit that you would like to use, you can go directly to that patient packet 1 or patient packet 2 or some of the clinical guidance or the patient-facing resources. And here's an overview of our screening tools. We've not only included the packet of packet 1 and packet 2, the patient-facing screeners, but also a resource that I think will be very helpful to you and what these score cutoffs mean and what to do next. So we'll look a little bit more closely at those in the next slide. This slide shows you for the EPDS and the PHQ-9 and the GAD-7, if women are falling in these different categories, what we would recommend as next steps. So if they're scoring mild, we would recommend some watchful waiting, psychoeducation, rescreening. in a certain amount of time. When we're looking at moderate or possible depression, we're wanting to really say, here are some things that you can be doing, self-care plans, and make sure we rescreen and give some psychoeducation about what might come next if things get worse or if they get better, and then so on and so on. So if we're moderate, what do we do next? How do we help support a woman who is trying to weigh what our options are in treatment when we have moderate or severe depression or anxiety symptoms? And we want you at all times, anytime you have a question, to call PeriPAN, because we're here for you. And when you call and say, the woman I was seeing right now scored in this, scored a 12 or scored a 22 on the PHQ, it really helps us guide you on those next steps. We also have other scores for the MDQ, which is a mania screening, and the PTSD scale. So these may not be scales that you use every single visit, but we do recommend the MDQ being given at one point during pregnancy, especially before an SSRI is started, and then the PTSD scale as a screener as well, to really understand if a woman has suffered trauma and is having those symptoms now. Another tool in this toolkit is our psychoeducational resources, and these are really patient-facing. There's a self-care plan that we think is a good idea for every single mama or mama-to-be about, how to take care of yourself in this transition in life. There's also an action plan for mood changes during pregnancy or after giving birth. So a way to provide education to mom. If this happens, if you're feeling this, then this is what we would recommend next. And so if mom's at home feeling worried about how she's feeling, she has a little bit more guidance in when to call, when to follow up, what are some things she can do that are proactive to help her mood and anxiety during this difficult time. And then we provide a safety plan as well. A safety plan is an evidence-based intervention for reducing suicide, and it helps us think about proactively things we can do when we're feeling distressed. So different coping skills we can implement, self-care things that we can do. You can refer back to the self-care plan, people we can contact, emergency lines we can contact, and making our space safe. So all of these resources are available either in that overall broader toolkit or as self-select from that main screen I showed you earlier. And so we are your partner in these consultations. We want you to call PeriPAN. We want you to use the toolkit. We want feedback on the toolkit if you have questions. We want you to call PeriPAN if you ever have a question about the mental health care of your patient. These tools within this toolkit help us help you better, and also help set a precedent and a cadence for the assessment and response to mental health care in your clinic. PeriPAN is a no-cost, rapid response clinical consultation service. And if you can call in real time when a patient is in your office, you can call when a patient calls you and has a question about something that's going on with them and you're not quite sure how to answer or how you should guide them. Please call PeriPAN. We can work together in discussing what are those clinical next steps. We can even do a one-time direct patient consultation via telehealth to better understand the diagnosis and guide in those treatment steps.
I am very excited about PeriPAN. I want you to know that I have been able to use it myself. I have found it very simple and informative. I've also been able to direct my residents and fellows to use PeriPAN, and they likewise have found it very simple to use.
So please call us. We want you to add this number to your contacts in your phone so that you have it at your fingertips whenever you need it. We want you to follow us on social media on both LinkedIn and Facebook, so you can hear new things that are coming out and best practices, psychoeducation, resources for your patients in this perinatal period. And we want to assist you if you have any questions regarding the toolkit. please scan this QR code and it will go into a document that we can both look at those questions, make improvements, work together, and respond to your questions. This is a journey we are on together that we want to support you and learn from you and with you. And we appreciate you looking at the toolkit, using the toolkit, and that we can work together to better the mental health care of our pregnant and postpartum patients in Texas.